Most people think they understand rabies. A dog bites someone. The person gets infected. The disease progresses. Simple. But what if I told you a man died from rabies without ever being bitten by a dog? No bite. No attack. No obvious exposure. And by the time doctors figured out what was happening, it was already too late. This is one of the most unusual rabies cases ever reported, and it reveals a terrifying lesson that could save lives. The story began with what seemed like a completely ordinary injury. A middle-aged man accidentally cut his thumb while working. The wound wasn't serious. About 1.5 centimeters long, a little bleeding, some discomfort. Nothing that suggested a deadly disease was on the horizon. Doctors cleaned the wound. They stitched it, applied dressings, and sent him home. Everything appeared to be healing normally. Life moved on, or so everyone thought. Then something happened that seemed completely unrelated. A relative was bitten by a stray dog. Naturally, family members rushed to help. There was confusion, concern, panic. And during that moment, blood from the dog bite victim accidentally came into contact with the dressing covering the man's healing thumb wound. Nobody thought much of it. After all, he wasn't the one who got bitten. So why would he need rabies treatment? That assumption would eventually become fatal. For weeks, nothing happened. And this is one of the reasons rabies is so dangerous. The virus often remains silent, sometimes for weeks, sometimes for months. A person can look completely healthy while the virus quietly travels through the nervous system toward the brain. Meanwhile, the countdown has already begun. Then strange symptoms started appearing. At first, they were easy to dismiss. Difficulty sleeping, restlessness, irritability, anxiety, maybe stress, maybe exhaustion, maybe nothing serious. But doctors would later realize these were early warning signs. And then something even stranger appeared. He began feeling unusual sensations in his arm, crawling feelings, tingling, stinging, almost as if insects were moving beneath the skin. Doctors call this paresthesia. Let's break that word down. Para means abnormal. Esthesia refers to sensation or feeling. So paresthesia literally means abnormal sensations. In simple terms, the nerves begin sending signals that shouldn't be there. The person feels things, even though nothing is actually touching them. And in rabies patients, this can be an early sign that the virus is affecting the nervous system. But doctors soon noticed something even more alarming. And this is where the story takes a terrifying turn. Before we continue, if you're learning something from this medical mystery, consider subscribing to Health Casefile. Our mission is simple: to transform real medical mysteries into life-saving health awareness. Because understanding how diseases work today could help save a life tomorrow. Now let's continue. Soon, the patient developed one of the most famous signs of rabies: hydrophobia. Let's break that word down. Hydro means water. Phobia means fear. So hydrophobia literally means fear of water. But rabies patients aren't simply scared of water. The virus causes painful spasms in the throat whenever they try to swallow. Eventually, even seeing water can trigger panic, distress, and intense discomfort. Imagine being desperately thirsty, yet unable to drink. That is the nightmare many rabies patients experience. Then came another frightening symptom: aerophobia. Aero means air. Phobia means fear. Fear of moving air. Even a small breeze blowing across the face could trigger painful spasms. At this point, doctors became deeply concerned, because these symptoms pointed towards something very specific, something deadly. The patient began drooling excessively, sweating heavily, becoming confused, disoriented, agitated. Doctors call this state delirium. Delirium is severe confusion caused by a malfunctioning brain. The person may struggle to understand reality. They may become frightened, restless, or unable to think clearly. And in rabies, delirium often means the brain itself is under attack. At this stage, doctors suspected rabies, but they needed proof. Samples were collected, laboratory testing was performed, and the results confirmed their worst fears: rabies virus. The diagnosis was now certain. Let's pause for a moment. Why is rabies so feared around the world? Because once symptoms begin, survival becomes extraordinarily rare. Rabies attacks the brain and spinal cord. Doctors call this encephalitis. Let's break that word down. Encephalo means brain. Itis means inflammation. Encephalitis literally means inflammation of the brain. The virus travels through nerves until it reaches the central nervous system. Once it arrives, the damage can progress rapidly. And unfortunately, medicine has very few options at that stage. The patient's condition worsened quickly. Seizures developed. His consciousness faded. His organs began failing. And despite medical treatment, he died. A disease that is almost completely preventable had become almost impossible to stop. What makes this case so extraordinary is that he was never directly bitten by the dog. Investigators believed the virus may have reached his healing wound through contamination involving infectious saliva. And this teaches an important public health lesson. Many people think rabies only spreads through dog bites. That is not entirely true. The most common ways rabies spreads include cat bites, bat bites, scratches contaminated with infected saliva, saliva entering open wounds, saliva contacting the eyes, saliva contacting the nose, saliva contacting the mouth. In extremely rare situations, indirect exposure involving infected saliva may also be possible. The important thing is not the bite itself. The important thing is exposure to the virus. And here comes the most heartbreaking part. The relative who was actually bitten by the dog survived. Why? Because he received rabies treatment quickly. Doctors administered post-exposure prophylaxis. Let's break that term down. Post means after. Exposure means contact with the virus. Prophylaxis means prevention. So post-exposure prophylaxis simply means treatment given after exposure to prevent disease. The vaccine worked. The virus never reached his brain. One person received treatment and lived. The other believed he wasn't at risk and died. That difference changed everything. So how can rabies be prevented? The answer is simple. Act immediately. If you are bitten, scratched, or exposed to saliva from a potentially rabid animal, wash the area thoroughly with soap and running water for at least 15 minutes. This simple step can dramatically reduce the amount of virus present. Then seek medical care immediately. Not tomorrow. Not next week. Immediately. Doctors may recommend rabies vaccination, rabies immunoglobulin, additional wound treatment. The earlier treatment begins, the greater the chance of preventing infection. Communities can also protect themselves through vaccinating dogs, controlling stray animal populations, avoiding contact with unfamiliar animals, teaching children not to approach stray dogs, reporting suspicious animal bites, supporting public vaccination programs. These measures save thousands of lives every year. This case teaches something powerful. Sometimes the greatest danger isn't what we know. It's what we assume. This man assumed he wasn't at risk because he had never been bitten. But rabies doesn't care about assumptions. It only needs a pathway into the body. And once symptoms begin, time runs out quickly. If you learned something from this story, subscribe to Health Casefile. Because every symptom tells a story. Every disease leaves clues. And sometimes, understanding those clues could save a life. Disclaimer. This video is for educational and health awareness purposes only. It is not medical advice. Always consult a qualified healthcare professional for medical concerns. The next medical mystery might be hiding in plain sight.